Can you share a little bit about your background and focus on your research?
Sure. So my background is in my background's in cancer prevention control research, right? I have always focused on the cancer prevention. I focused on the treatment side for a while, but focused on the cancer prevention side when I was a postdoc and working at Mayo Clinic and now here in Virginia Commonwealth University. And my training, though, is more in social and behavioral sciences. And the path of my training, interestingly enough, kind of led me to moving from a position at the Mayo Clinic in health services research and cancer prevention research to Black studies at Virginia Commonwealth University, which is like people try to figure out like how did she end up there? I've always been interested in equities.
Mhm.
And since I was a child, I was one of those people that always tried to understand why do some people have, why do some people not have? Why are there children starving in Africa? Why these are always things that were in my mind, right? And so they've sort of paved the way for the type of research that I do now, which is in cancer prevention and tobacco control and health equity.
Oh, that's amazing. Great.
Yeah,
Um, what inspired you to focus on this particular kind of work?
on tobacco control.
Yes.
Yeah. So when I was people always ask me this question, and it's kind of like, I don't know. When I was a graduate student, I wasn't particularly interested in tobacco.
Okay.
And and there's another story to this that I'll try to tell you very quickly. But as I said, I was interested in equities, right?
Right.
So I was working in a Center for Health Outcomes and Pharmacoeconomic Research. Um, working with pharmacists, and oftentimes we were doing work in smoking cessation drugs, right, medications. And then I moved to the cancer prevention control program, and I was focused on tobacco because that's the work that they were doing that they were most interested in, right? Still really wasn't very interested in tobacco.
Mhm.
But somehow I happened upon a listserv, and there were individuals talking about tobacco. And I think my mentor, linked me into this listserv. And there were two strands of people. There were two groups of people. There were the individuals that were focusing on tobacco treatment
Mhm.
and sort of the epidemiology, the patterns of tobacco use and things of that nature, which is what you would expect, right? Very traditional. But then there was this other group of folks that were really into policy and advocacy and change and things of that nature. And it was at that point where that's what hooked me into tobacco, because the individuals who were focusing on the policy and advocacy were focusing on Black populations
Mhm.
specifically,
Okay.
and they were focusing on menthol, right? Menthol cigarettes. And the way that they would speak about how the tobacco industry operates is what drew me in, to be honest, because I was just like, okay, you have this big business, you
Okay.
have policymakers, you
Okay.
have, predatory practices and all sorts of things. And I was like, this is like the worst soap opera on the worst day with the worst
Mhm.
characters. And so I think I was compelled
Right.
by the drama at first, and then I was compelled because I realized that these were inequities that we could actually affect change with, right? There was a clear adversary, there was a clear target, which is the tobacco industry that preys on communities. And
Yeah.
so for me, that's what pulled me in, to be honest. And that's what's kept me over the years. But I was early on just like everyone else, which is it's like, well, if people want to quit smoking, they'll just quit smoking.
Right. Right.
That's not how it works,
Yeah.
right? That's not
Right.
how it works.
That makes total sense. Um, so the next question I have is how might the live experiences of being a Black person in the U.S. influence smoking, vaping, and other tobacco use?
So, that's interesting. So this is where my Black studies comes into play,
Okay.
right? Um, and this is why I actually went into African American studies. I'm in the College of Family Medicine, or the Department of Family Medicine now. Um, but when I came from Mayo Clinic, I realized that the individuals that were studying tobacco use in Black populations didn't quite understand the lived experiences of Black populations, right? So using these products, vaping, um, smoking menthol cigarettes, little cigars and cigarillos, all of those things are happening within a context,
Mhm.
right? People don't just, you don't smoke a cigarette, you don't use these products just in isolation.
Right.
They're in a broader context. And the context can shape the behaviors of individuals, right? So in the case of tobacco, and I'm gonna use menthol as an example because that's what's closest to me, but this transcends across to tobacco products. So if anyone thinks I'm just talking about one, I'm not, I'm talking about them all.
Okay.
Um, but what we find in Black populations in particular is that we've had a history in this country of racist policies, racist practices. Our country in and of itself is structured on a social stratification system that's based on race,
Yeah.
right?
Hmm.
And therefore, and this is not to say, oh, everything's racist, everything's
Right.
racist. That's
Okay.
not what I'm saying.
Right.
What I'm saying is that the systems and structures that are at play, the things that we interact with, the institutions, the policies, the practices, the jobs that we have or we can't have, the places where we can live or can't live, these are all policies
Yeah.
that were constructed to advantage some groups, right? And to
Okay.
disadvantage others. That is how America works. Now, the
Yeah.
problem is, for me as a Black person and a person, who has been in Black studies, is that it's stratified based on race in this country. Other places it's income. Other places it's somewhere else it can be, nationality, right?
Right.
Everyone's got their own quirk. But in the US, it's structured on race. And so we've created conditions where we have large concentrations of Black people or African Americans who live in specific neighborhoods because of redlining or
Yeah.
because of predatory lending with housing, right? And it creates, so these conditions that are created by these policies, I was going to say something else. I'm going to go back to that for a minute. But so I just want to tell you this: with the redlining, we have the policies. We also have in these same neighborhoods, we have divestment in education, right, in schools, right.
Yeah.
We have less access to jobs that increase your social mobility or that have insurance or that have the things, basic needs that we all have, right? So when we create these conditions and we have these large concentrations of Black folks in these neighborhoods, it's a perfect way for tobacco industries to specifically target neighborhoods, or not just neighborhoods, but communities, right? Because we have these concentrations of people. And so we say, hey, we have a captive audience right here because we have large concentrations of folks in these areas. So let's exploit the fact that we have these people in these spaces. Let's exploit the fact that these people don't have the same sort of social mobility as other populations. Let's exploit the fact that these neighborhoods have schools in which the local governments and state have divested in terms of education, right? So this is an opportunistic industry that has created the conditions in which Black people in this country, unfortunately, use these tobacco products, and some of them are more difficult to quit than others.
So it's more like in certain neighborhoods, you will see more like little markets, that have alcohol and tobacco and the advertising versus having, you know, big, larger grocery stores with fresh fruit. So it's really about the social economic status. And like you said, they're purposely targeted, in those particular areas around communities of color and how
Yeah,
they,
it's socioeconomic status, but again, I always want to make sure that we say, because America's all about like pull yourself up by your bootstraps,
right.
right? If you want to get ahead, you'll just get ahead. No, that's not true.
Okay.
That's not, we have systems and structures that have met that were built to advantage some folks, right?
Yeah.
And yes, you're correct. So in these neighborhoods, oftentimes what we'll find is we'll find that there's more marketing in
Yeah.
those
Definitely.
bodegas or those small markets that we're talking about, right? What do you do? What do you see when you walk into them? You see more tobacco advertising.
Oh, wow.
Yeah, you see tobacco products right up there in the front. And what else do you see? You see a whole bunch of junk food, a whole
Yeah.
bunch, you don't see fresh fruits and vegetables, right? So you
Right.
see all of these things that can contribute to the poor health of Black communities around the country. And it is important to note that obviously not all Black people in America live in these neighborhoods, right? And so some people have greater exposure and therefore at greater risk. And whereas other folks that are not in these spaces and places have less risk. You see what
Okay.
I'm saying?
I
So
do.
it's really complicated. And when we say Black Americans or Black communities, there are a whole lot of different Black communities,
Yeah.
but there are very specific Black communities that are at greater risk and unfortunately have more difficulty quitting tobacco products.
Thank you. That really, I just resonated with all that. So, and it makes sense to understand how it's really strategic and it's targeted and it's intentional. So thank you for answering that.
Well,
So,
so can I tell you something else really quick here? Can we just talk? So let's think about it. So we have this broader like thing happening with the tobacco industry. We have these policies that disadvantage some folks and create the conditions in which people live, right? But we didn't talk about what it feels like to be Black in America, right? And that's not always easy
yeah,
either, right?
right.
Um, what we find in well, we won't even talk about the science. Let's just talk about our family members, right?
Yeah,
We see that for some individuals within our family, things are harder. For
yeah,
my nephew, things are harder. He's a Black man. He's a young Black man that lives in, a state that is not particularly hospitable to young Black men, right? And so he has additional stressors just trying to navigate the world on a daily basis, just to go to his job
right.
that other folks don't have, right? And so we again, it's about those conditions.
Yeah,
It's about the environment that influences our stress levels, that
yeah,
influences our response to those stress levels. If I'm all stressed out and I'm just trying to get to work, just trying to get by, or I'm just trying, I
yeah,
may not even try to get by. I might be me where I have more advantage, but it's hard.
yeah,
It's not easy because I'm still navigating these things. I can move through a lot of things, but I can't move through society's response
right,
to what I look like,
right.
right? And that also contributes to higher use of tobacco products
Yeah,
within our communities that other
definitely.
people, it's a disadvantage that other people don't have.
Yep, I agree with that. It's a stressor. It's like you said, being different stresses that comes with being a person of color. And so because we lack a lot of resources, maybe mental health support or just different folks in our community that we could tend to, rely on to release those stressors, then it's easier to say, hey, I can go afford a $10 pack of, tobacco or a vape or whatever, because I really don't have those resources that I need to release stressors due to like maybe not having a job or my job doesn't have medical insurance and I don't know how to connect to those resources. So I agree with what you're saying because it's so much bigger, and there's so many layers to uncover. But yes, definitely. Yeah.
Yeah, but when you think about it, right? So you're talking about these research. The way that tobacco work, or the way that nicotine and tobacco use works, it's really, again, this is the thing that I enjoy about it, but it's the same thing that like
Yeah.
it makes me want to take them down. Um, is that so we're talking about stress, right? Just trying to
Right.
live your everyday life, which is America's hard, and I don't care who you are, America's a hard place to live. Um, and what happens? And you were saying, well, maybe I can afford a $10 pack of cigarettes, whatever. I think it's even more automatic than that,
Okay.
right?
Right.
I think I'll give you my lived experience as an example,
Okay.
right? But hopefully it'll illustrate the point. So my mother used to smoke cigarettes when I was growing up.
Okay.
Hated them. Hated them. Couldn't stand the smell. I used to like go to her purse and I'd like crunch them up in her purse so that they would break and make her think that she just had too much stuff in her purse,
Right.
right? Apparently my sister used to go and she would like take them out of her pocket and she'd throw them in the neighbor's garbage, like 10 houses down.
Mhm.
Right. So we all hated cigarette smoking
Oh
in our
yeah.
house. My mother ended up having pancreatic cancer,
Mm.
okay, which is linked to smoking. My
Oh,
mom smoked menthol cigarettes. What did
wow.
I do as soon as I learned that my mom had pancreatic cancer, I started smoking.
Oh.
Now I'm the kid that hated it, right?
Um,
I'm the kid that couldn't stand the smell, knew it was harmful to my
yeah.
mom's health, right? But what I learned, I didn't think to myself, "Oh, I'm going to smoke." It was automatic for me because I had seen that this is how my mom coped
Okay.
with different stressors, being a single mom raising four kids
Mhm.
by herself, four girls,
Okay.
right? So I started smoking cigarettes.
Okay.
But the difference between my mom and myself, my mom smoked menthol. She grew up in Black neighborhoods.
Mm-hmm.
She raised us in predominantly white neighborhoods. I
Mm-hmm.
smoked what my friends smoked. I didn't smoke
Mm-hmm.
menthol.
Okay.
It's about space and place, right? So the pattern was the same,
Right.
but my choice was
Okay.
different because I wasn't bombarded with tobacco product or to menthol ads everywhere, and because I had an option to choose. I did end up smoking for many, many years, and then I finally was able to quit. But it was automatic. It
Okay.
wasn't, I didn't even have a chance to think. And the
Right.
interesting thing about how tobacco works and the tricks that it plays is that so when you're stressed out, you grab a cigarette. You don't think about it. You're like, oh, this is gonna help me calm my
Right.
nerves. Or you vape. This is gonna help me, chill and I can get through the day. Here's the trick is that it actually exacerbates anxiety. It
Mm,
exacerbates stressors. All of the things that we think that it's
yeah.
doing, it's
Right.
actually doing the opposite, which drives us to try to correct and to use more or to smoke another cigarette because I need to like calm down. When in fact, it's amping us up,
Oh, wow.
right? So these are the things that I find interesting, right?
Yeah.
About studying tobacco because I'm just like, how does that happen? You
Yeah.
know, I know what I felt. I know what the people that I conduct my research, I know what they think is
Right.
happening. But in fact, it's the opposite. And so we need more, and it makes it harder to quit.
Oh, wow. That's deep. I didn't even think about
It's
that.
wild.
Yeah.
But you
Yeah.
see, and I'm like, well, I'm old now. It's like I've been doing this for like 15 years, but I still get excited about it because I'm just like,
Yeah.
how does this is wild. And you think, okay, this is like the leading cause of preventable death, disease, disability.
Yeah.
We can do something about this, right?
Yeah.
And but yet we can't we don't
Yeah.
sorry we don't as a society, so now it becomes the onus is upon the people who are
Mhm.
unfortunately dependent on these products. We have to try to find ways to support each other and try to find
Right.
ways, whatever resources we have, because the odds are stacked in ways that make it very difficult to quit using tobacco.
Thank you. Great conversation. Thank you. So the next question, can you discuss any specific challenges that you observe that Black people and communities may face that are different from others when trying to quit smoking or vaping?
Yeah, there's a lot. So all of the things that we said, right? The conditions
Yeah.
that society is sort of structured, those are just a given. Those are
Yeah.
there. But then there are some products that are more difficult to quit using than others. As I said, menthol is one of them that's very, very difficult to quit
Mhm.
smoking. Menthol cigarettes, menthol causes increased nicotinic receptors in your brains. It contributes to higher levels of dependence. It's easier to inhale and hold in for long periods of time and let the poison go down more smoothly and sit there. So those are all sort of the sciencey things of it, right? And with menthol in particular, the cessation that we have on the market is does not work well. Let's say that.
Mhm. Okay.
Um, and in terms of other products that make it more difficult, we have little cigars and cigarillos within Black communities. We have increasing numbers, unfortunately, of young Black young adults that are using vape devices, right?
Yeah.
Electronic cigarettes and vape. And we also have hookah now. We've got these fantastic hookah lounges in Atlanta where you see all these beautiful Black folks, all my people, and we're surrounded in these toxins and poisons,
Yeah.
right? So in some ways, it's it was what I said earlier, which is the conditions that are created that make it more difficult. Some of it is that the science, some science, not all, has not adequately addressed tobacco use in Black populations
Mhm.
in the same way that they have with other groups. Um, then there's the stressors, the everyday lived experiences of being Black in America, which people, some people sort of side eye me when I say that. And I'm just like, I'm sorry. I'm just telling you what the data show and I'm telling you what the people say. So the confluence of all of these things, right? We have all the advertising and but the confluence, the intersection of all of these issues make it particularly difficult to
Mhm.
quit smoking when you're Black in America, right? Um, and it's not about our skin color. That's the thing that I always want to continue to say. right? Race is not genetic, it's not biological. It's not about our skin tone. It's not because we're weak. It's not because of all of these other things. It's because the odds are stacked against us in so many ways, but it does not mean you can't be successful.
Right.
Right. So I want to make sure everybody
Yes.
understands that is that it is harder, just like getting a job it can be harder, just
Mhm.
like moving up and moving to a different neighborhood can be more difficult, just like getting into medical school can be more difficult.
Right.
This too, we have, we have similar challenges. I always tell people, I always say, I'm like, other people, they have heroes, right? But Black people, we got superheroes, right? Like, because we have to overcome so much more to have the same, opportunities
Yeah.
and access to resources as
Yeah.
other folks do,
Yeah.
right?
Yeah.
Yeah.
I wanted to, I'm from the Pacific Northwest, so I recently moved to Georgia, and I see how, like you were saying, like the hookah, and it's again, you can kind of go on and say because Georgia, like you said, the population, the amount of people of color here versus where I'm from in Pacific Northwest, where hookah's just not a thing,
That's right.
and so it's really, and it's amazing how when you kind of, like you said, it's really fascinating on how so much how it's kind of targeted, right? Because it's like, why is hookah, why is this a thing? Like in lounges, in restaurants, and
That's
it's really
right. That's right.
targeting
That's right.
our young African Americans. And
And those are not young African Americans
yeah,
that are living in those disadvantaged neighborhoods. Those
right.
are individuals that have resources, right?
Yeah,
So
yeah,
we're still sneaking in and bringing it, sort of increasing the risks for disease, the risk for
yeah, definitely.
dependence, because
Mm-hmm.
those are folks in the hookah lounges. Like that's the place to go, right?
Yeah,
There's a lot of students from
yeah,
HBCUs that will hang out at the hookah lounges and think, okay, this is not a problem. When these because I don't use them every day, or
right. Yeah,
I don't have I'm not I don't have dependence because I don't
yeah,
use it every day, but you're still exposing yourself to these
yeah,
toxins
exactly.
and these poisons that will harm your health in the
Yeah,
end,
yeah,
right?
yeah,
And that's and the we won't even get into, okay, well, I didn't use the hookah. I just sat there and I was having, water or a cocktail or whatever. You're still
you're
exposed.
still exposing
You're
yourself to
still
it.
exposed to all of the carcinogens.
Yeah,
And so and we're gambling with our
yeah,
lives then, right? And
mhm,
it is very much um, geographically situated, right? So
yeah,
in California, I was born in California. I'm from LA originally, but in California, we found that a lot of people use little cigars and cigarillos, but they were using one specific brand, right?
mhm, mhm,
And when I came to Virginia, everyone was using Black and Milds. They were using Swisher Sweets,
right,
but they were using Black and Milds here, right? And then the folks that lived here, that's what they thought
okay,
product to use was, right? It's about your social networks. The
yeah,
folks in Atlanta that you're talking about, the social networks, they're
yeah,
going into hookah lounges, and this is just part of, socializing and things of that
right,
nature, right? And so but it shapes our behaviors, and
yeah,
unfortunately, in the long term, it shapes our health and it shapes our health outcomes. And
yeah,
that is the greatest problem, right? That's the thing that's the most damaging to our health. And we also know that the African Americans, we have baseline um, higher levels of multiple chronic
right,
diseases, whether you're young or you're old,
yeah,
right? A higher predisposition for cardiovascular disease in
mhm,
young Black men that are going to college, right? Or the ones that don't. But young people, the types of diseases that you see in other populations later in life, we see them earlier.
earlier,
So
yeah.
we can't sacrifice our health. We can't take those risks because it causes so much damage.
Well, that kind of hits personal for me. So now I know, like, even though with the brunch and everything of, and
Mm-mm,
people
mm-mm,
and the
mm-mm.
hookah. So now I know that, I need to
That's
be,
right.
yeah, I need to be cautious on where I'm at because like you said, I don't do, but the smoke and what they're blowing into the air. So thank you for sharing that with me.
Yeah, you don't have to use the hookah, right?
Right.
But if
You
you're
could
in
just,
that environment, you're inhaling it. You're
yeah,
exposing
definitely.
yourself to it. And when you walk out,
Yeah.
it's on your clothes, it's on your space. And then other people are exposed to like tertiary
Yeah.
smoke exposure. So not secondhand. If you're not doing it secondhand, the other one is tertiary. So
Yeah.
yeah, just steer clear and go to the brunch spots that have
Right.
it's just food. It's just food.
Right.
Because it's going to make the food taste bad anyhow. So it's okay.
Yeah. Yeah. Well, thank you. Okay, so we'll move on to the next question. What strategies have you found to be most effective in helping a person to quit? Are there any community-based interventions or support systems you feel particularly effective?
So there's two answers to that. I have two levels, which is whatever works for you, do
Mm-hmm.
it,
Right.
right? And quitting tobacco use in any form is really tough. It's very difficult. It may be something that you feel like you fail at. You have to try again. That's what we see in the research with Black populations, is that we make more attempts to quit using tobacco products. Um, and so whatever you think works for you, just try it and just stick with
Yeah.
it. Now, that's the one level, right? Because people will tell you, well, you need to do quit lines. Well, you need to see your doctor and
Yeah.
find a medication that will support you, whatever. It can be, it depends on who you are. It depends on what you have access to. It depends on what works for you, right? So that's in part, that's one of it. And the first try with a community-based organization, you could have a local cessation group in let's say Richmond, where I live. And if that doesn't work, then I'm going to try something else, right? So that's the first thing that I would tell individuals
Okay.
is that no matter what you do, continue to try to find what works, because inevitably you will win.
Right.
Inevitably you will quit, right? If you continue to try hard enough. That's one. The second thing is that oftentimes in our communities, we have community-based cessation programs that are fantastic, that we do in person, that we get to connect with other individuals and things of that nature. The problem is with some of these is that they're not, it's not that they're not good, they're great. They're just underfunded.
Yeah.
Like, like remember I said the schools are underfunded, the
Right.
neighborhoods they
Right.
divest
Mhm.
in, right? They don't support these programs all the time from state and federal funding. So sometimes a program will pop up and then it'll be very successful. People love it. It's worked, but it'll go away. So I would say, so if that should occur, if you find something that works for you locally,
Okay.
but for some reason you don't have access to it for whatever reasons, perhaps the hours that they meet or something of that nature, then you need to find another one. Find something that
Okay.
what you have for Truth Initiative. You could join the Become an X program, right? And I'm not actually touting this because it's funny because I didn't even realize that Truth Initiative's program was developed with Mayo Clinic, and I used to work at Mayo Clinic, and I was like, oh, huh, interesting. That's not why I'm doing it. I say that because there are some programs that
Mhm.
actually tailor their cessation program for specific populations and for products, right? Some of them just it's all products across the board, but some of them are really tailored. Some of them are understand the lived experiences of Black
Right.
populations or
Mhm.
LGBTQ plus populations or whoever it is, people living in rural locations. They understand this and they fold it into the work that they're doing that help to sort of
Okay.
personalize the treatment that we're seeking. So, and I'll say this also because I used to be a proponent of doing everything local,
Yeah.
but when I realized that these programs would come and they would go, and some people might need them longer,
Right.
right? You may need more than 6 weeks. You may need 12 weeks. You may need a year. You may need 2 years. So the programs that are invested
Yeah.
in that are heavily invested in quitting, that are not doing something else
Yeah.
but just focusing on quitting, those are the ones that I would go to
Okay.
be honest, because you'll know that you'll have longevity. You'll know that it's always there. You can find something that's easily accessible based on when you go to school or when you work or things of that nature. Those are the programs that I would look for. But I would also, again, um, there's no one size fits all,
Okay.
for anything. And so if you find a program, you find it doesn't work, or you slip, off the wagon, or fall off the wagon, find another one,
Okay.
and if that one doesn't work, find another one. Because this is your life, right?
Right.
Our lives are precious. It's the
Yeah.
one thing that we have that is invaluable, right? So I'm going to try to find as many resources as I can until I can reach that goal.
And this might be, this is a follow-up question, because you said you were a previous smoker. Did you tap into community resources? What kind of helped you, you know, stop smoking?
Which time?
Okay, so it was, okay.
See, that's what I'm saying, right? So I say
Okay,
this as a researcher, but I also say it as a person with a lived experience of being
right.
having smoked, right? Which time? It's so
What
when did I
made you quit for good? Like, what made, like, this is it? I'm not, like, what was that ultimate thing that, like, what resource? What was your mindset? What made you just stop?
I would love to tell you. So I have tried almost every product on the market, right? I think I tried back then they had nicotine inhalers. I did the patches, I did lozenges. Those I didn't like the way they tasted.
Okay,
Gum made my mouth feel strange, right? Didn't really work well for me, but it actually did help to soothe
okay,
my needs, right? Um, when I was in pharmacy, I tried Chantix, venlafaxine. These things, but I always started smoking again. Actually, that's not
okay,
true. Chantix I quit, but I think that the thing, so I tried everything. I tried quit lines, I tried behavioral counseling, I
okay,
tried everything. And I was struggling with, for me, it was a little bit difficult because I wasn't a heavy smoker. I used to just
okay.
smoke a couple of cigarettes a day. And so, my mind would play tricks on me thinking, oh, it's only a couple of cigarettes a day. I can
Mhm.
quit this very easily,
Right.
right? When in fact, it was harder. Um,
Mm,
so I think I probably tried most available resources on the
okay,
market in part because I just didn't want, I want to be able to run. I want to be able to
okay,
breathe. I don't
right,
want to have to hide smoking and like hide behind buildings. I just didn't
right.
want to do that anymore.
Okay,
Uh, I cannot tell you the number of times that I was not successful actually because they're countless. And
okay,
I think that the thing that I'd love to tell you that the one thing I finally quit or that helped me quit was that I had this, you know, I had this magic
okay.
intervention or I had this magic treatment. It wasn't that. I kept
Mm,
kept trying. And
okay,
I almost think that at some point I got tired of trying and I just stopped.
okay.
Right? Because I was never going to take my eye off that prize. Like this is what I
Right.
wanted, right? But I actually think that, when you try enough, eventually you will succeed.
Yeah.
So
Mm-hmm.
the key is never to give up, right? You may have a little tiny gap, you may have whatever, but the key, if you continue to try and you'll each time you may make a little more advancement,
Yeah.
maybe you'll slide back a little bit. But for me, I think it was just I never gave up. And my husband smoked and he quit
Okay.
also. So maybe there's a little bit of competition there. I don't really know.
Well, thank you for sharing that. Um, how do you think educational institutions and community organizations can support Black individuals in their effort to quit smoking?
So I think that educational is, first of all, let's make sure that the HBCUs don't like have events and hookah lounges in Atlanta. I think that educational institutions have a huge role, right? So when we're talking about education, there's a spectrum, right? We have K through 12, we have young people,
Right.
and then we have higher education as well. Um, I do believe that they can focus on very low-hanging fruit for themselves, which is making their campuses smoke-free campuses,
Hmm.
right? Creating more, don't make it so easy to have that automatic response that I said earlier,
Yeah.
right? Make it a little more difficult. I might have a chance to think about it, and then maybe I won't, pick up
Yeah.
that product. So in one way, there's some ways I think that creating smoke-free campuses is a great way.
Yeah.
Providing resources for not only the students, but for their families,
Right.
right? Educational resources and outreach for their families would be great. One of the things that I always think about with K-12, let's say,
Mhm.
African American young kids, youth, and adolescents have higher rates of asthma when compared to other groups, right? And the asthma leads to um, lower rates of school attendance, right? You have
Yeah.
higher hospitalizations, you have kids that are missing schools and all of that sort of thing. Then when you have the kid missing school, then you got the parent has to come pick up the kid because they're missing school. And so now the parent's no longer at work. Well, so we have this asthma issue within Black communities.
Mm-hmm.
And one of the simultaneously, African American communities also have the lowest rates of an in-home indoor smoking ban. So
Mm-hmm.
these kids are exposed, right? So wouldn't it be great if in K through 12 schools or parents worked with other parents, right?
Yeah.
That and tried to do more outreach or more engagement
Yeah.
about how to improve the conditions for their children, right? And you could do it with smoking, but people won't think about it. They're like, oh, let's just do it with homework. No, create the circumstance in which the kid can be at school more often, and then we'll also work on these other issues as well, right?
Right.
So parents can become involved in those spaces that are concerned about our youth. Um, K through or college, we could provide in college and community colleges, we could provide resources for students,
Mhm.
resources help provide support for their families, and also give back to the communities.
Yeah.
Right. And so instead of taking money from tobacco industries, which is what my university does and some others do, so instead of taking money from the industries that harm our communities, how about we try to find ways to give back and put those resources back into the communities? We have
Yeah.
a lot of expertise at universities, for
Yeah.
example. Why don't we create more community-based cessation programs? Why don't we find different ways of trying to improve the lives of the individuals that are our neighbors, right?
Right.
So that's one of the things I think we do. In terms of organizations, I think that community organizations, they many of them focus on many things,
Yeah.
right? Some people focus on smoking. How about you get the ones that are working on tobacco
Yeah.
to partner with individuals that are working on housing, to partner with individuals that are working on economic development,
Right.
workforce development, because these are people more likely to smoke, right? To partner with the folks that are focusing on food insecurity and creating food justice
Yeah.
and creating opportunities for individuals to have access to these fresh fruits and vegetables that we all need, that's
Right.
to our bodies. So there are a lot of ways that we can connect because
Oh,
many of
yeah.
these issues are intersecting.
Yes.
So there are a lot of ways that we can connect with community organizations. There's a Center for Black Health Equity that focuses on tobacco use and multiple other social determinants of health, other factors that contribute to the health of Black communities. There's also the AETCLC, the African American Tobacco Leadership Council. I always have it's a mouthful that focuses on policy
Okay.
and um, tries to advocate for policy
Yeah.
that will reduce the burden and reduce the risks for tobacco use within our communities, and that give us a fighting chance to actually get ahead in the end, right? So there are many ways, and average folks can right. You don't even have to be part of these organizations. All you have to do is be a person that actually cares about the health of your community. I'm always about, okay, we're into saving Black lives, right? We march, save Black lives, Black Lives Matters. How about we save Black lungs too? Because
Yeah.
that's our fight in the end,
Yeah.
right? So finding ways of working with various individuals and coalitions that have the mutual goal and interest in saving Black lives, in improving the well-being of our communities. Those are
Yeah.
the things. Churches can do the same thing.
I definitely like the idea of like parent peer support, right? I
Right?
mean, like a lot of schools, just depending on the school and the funding, the resources, some of them have, those family support workers that will go into the home. And I used to do that years ago. And I just remember when you ask certain parents like questions. But as you were saying, like, we go in there and we teach the parent how to read a book and how to interact with their child. But we don't teach them like, what triggers, are there smokers in the house, or, what does kids have access to? And that is something where I think it's really important for schools to get involved, especially like elementary school, like K through 5, where it's really critical, right? That piece where we're really trying to help parents. And those are questions that we could be asking, to
Yeah.
kind of provide them
Yeah.
those tools. I love that.
Absolutely. I mean, because it benefits the schools in the end,
Yeah,
right? So
definitely.
it benefits, so the investment that they can make with these communities actually benefits them because you have higher attendance rates, and then
Yes.
we have more greater, if your attendance rates are increased, then you get better, standardized test scores, whatever
Yeah,
it is that they're interested in, right? The
exactly.
kids have to be there to learn.
Hmm.
And if we don't create the opportunity for them to, create the space for them to actually have a fair shot in education, in the workforce, wherever it is that we're talking about, because they're all interconnected.
Yeah.
And if you don't have your health, you just
Yeah.
you can't get ahead. So I think that, and this is what I teach my students in my class, and they're always mind blown because they're like me. They have the same thinking that I had when I was in college, which is, well, people want to quit, they'll just quit, right? Because that never goes away.
Right.
But when they do research on it, I teach a class called Black Health Matters. But when they do research on it, they begin to generate all sorts, understand the intersections between where we live, work, play, and pray, and these social systems and structures. But there are so many places that we can actually intervene
Yeah.
when we choose to. It has to be a priority,
Yeah.
right? It has to be a priority. And we have to
Education.
stop thinking that if people just wanted to quit, they would,
They will.
because it's
Yeah.
not that simple.
Definitely not.
It's just not that simple. Yeah.
Thank you for that. Education definitely is the key. When we
Yeah.
know better, we do
It's
better.
one, right? But we can get them a lot of different ways. That's the
Yeah.
beauty of
Right.
it. Yeah. Yeah.
Okay, perfect. Next question. How do systematic issues like social inequities leading to reduced access to healthcare affect efforts to quit and vaping among Black individuals?
So part of it is the things that we were talking about, right?
Yeah.
So it's the unequal playing field
Yeah.
that we have, the way that the US is structured, it advantages some folks, it disadvantages other folks. Having access to care is critically important. One of my colleagues did a study recently, or she may have done it a while ago, but she went back and looked at the data. And it was a smoking cessation study within Black individuals, right? And adults. And what she found was that the individuals that had no health insurance, or individuals that had more than one job, um, or there was one more thing, I can't remember what it is, but it was basically linked to social disadvantage. And these were all Black people, the ones that had greater social disadvantage
Hmm.
were less likely to be able to quit. They were less successful
Mm.
quitting. The
Okay.
ones that had greater social advantages were more likely.
Okay.
And so we have to understand that the context and the environment oftentimes shapes our behaviors or drives our behaviors,
Yeah.
right? And it's not because we're weak or anything like that. It is because we sort of interact with the rest of the world every single day, right? So it can shape all of our behaviors, and it makes it more difficult. When we're talking about a United States, our social systems in this country, sociologists refer to this as functionalism. So we
Mm.
live in a functional system that's meant to perpetuate the status quo, the same patterns, the same practices, the same policies and things like that. And if you think about, I don't think of it as, I don't take it personal. I think of it like a machine that
Mhm.
works and it produces exactly what it was supposed to, right? And I wish one day I could figure out how to draw this out, but I just can't. Um, and so it reproduces disadvantage. It reproduces, lower levels of education when you're in a neighborhood and you haven't moved out of the neighborhood, and individuals, and the local government has divested, and you don't have, proper resources in the schools,
Mhm.
then you're going to have students that have lower educational outcomes, right?
Mhm.
Same thing with jobs. If you have access to only some jobs but not others, or even transportation, you don't have access to get to the good jobs. In Richmond, it's really fascinating
Okay.
because we have greater concentrations of Black folks. You can like cross a street and you can go from, it's the weirdest thing. It's because I'm from California. This never makes sense to me. You can cross the street and you can drive down the street and you get hit one point and the whole neighborhood goes from white to Black. Like
Okay.
it's stark, right? It is
Okay.
there's a stark contrast. And
Okay.
when I first saw it, I was just like, did we
Right.
move did we go to a different state? What is this, right? Um, and so it is those policies, those practices, those systems, those structures
Mm.
that we have inherited,
Okay.
right? And that are also still contemporary, that make it increasingly more difficult for people to be able to quit because we've created the conditions that make it more difficult for them to
Yeah.
quit. And we're talking about access to medications or access to nicotine replacement therapy
Mhm.
or access to behavioral support, right?
Yeah.
Some places don't invest as much in others, right? And it tends to be, interestingly enough,
Mhm.
tends to be the places where we have higher concentrations of low income and middle to low income Black communities.
Okay.
So again, it's those systems and those structures that are at place, and yeah, it's so complex, but yet it works so perfectly because we see the same social reproduction and disadvantage recreated again and again and again.
Okay. This is just so fascinating. I'm
She's
excited
like, I
for
thought we were
what
going to talk about
you
tobacco, right?
yeah, like I
It's
need
not just tobacco. That's the whole problem, right?
it's
Tobacco
just
is a symptom. It's like
yeah.
it's a cause for something else. It's a cause for death and disease in our communities, quite frankly. Um, but the tobacco use in our communities is also a symptom of these broader issues, which also when you understand it, to me, I find some level of comfort. If it
Mhm.
might sound crazy,
Yeah.
but to me, it's like, oh, okay, this is why it's harder. So we're not just like sliding into it, right? We're not just like giving up. It's that you're constantly bombarded every single day with more ads,
Yeah.
with price, cheaper products, right? You get like 2 for 1 in your in the at the bodega or something like that, and all of the other lived experiences, the day-to-day experiences, the grind
Yeah.
that stress all of us out.
Yeah.
It makes sense that people don't want to, but grab something to try to find comfort. And then if you don't have access to a primary care doctor that asks you the question, do you smoke or do you use tobacco products? And try to offer resources for you, right? Because we find that within Black communities, well, it's not Black communities specifically, that Black and African American individuals are less likely to receive counseling
Yeah.
or guidance related to smoking from our doctors.
Right.
Yeah.
And I think what I'm starting to see too, especially since being out here, even when because I'm from Seattle, so even when I moved from Seattle, you're also starting to see more vape stores, like, and they're popping up all over. So, I mean, not only do you have like the bodegas and the corner store where folks can just walk to, you're now having more access to vaping stores or vape stores or, inside the Black community.
Yeah,
And
and
so,
you don't really that actually breaks my heart,
yeah,
to be honest, because so I was here 10 years ago. I moved to Virginia, right? And when I moved here at that time, obviously we had vape stores and we had vape products on the market, but they hadn't infiltrated Black communities yet,
yeah,
right? And so I was like, okay, so we can get ahead of this one. And in some ways, I was like, I don't have to study e-cigarettes. I don't have to study these
right,
products because the communities that I focus on don't use them. Well,
yeah, yeah,
they got in. And the unfortunate part, well, not just the unfortunate part, is that, and you can see like different populations. So you can see, low income Black folks using like some combustible products. You can see um, college educated or students that are college age that may be more affluent that are using these vape products instead. I'm like, you dodged the bullet when you were a kid. Don't pick up now, right?
right, yeah,
But that's the look. The tobacco industry is, and I use it as a monolith. That's big business. And don't think for 1 second that these vapes and these cigarettes and everything else that are on these markets are not part of that same big business,
right,
right?
right,
And that business is that big business is in the business of creating products that you will want to use or that you use again and again and again and again. They want a loyal customer base, right? And they'll find a way somehow. If they're not going to this neighborhood now, they'll go to the HBCUs, or they'll go to the other communities. Or I could start vaping if I was a young adult because this is what my social networks, do now. And a lot of these young people actually don't. It's interesting because the same people that are college, I think about college age young people, they would never smoke a combustible cigarette in their lives, and
yeah,
yet they're vaping, they're inhaling this
yeah,
vapor with all sorts of toxins and carcinogens, and that we don't know the long-term effects of yet.
yes,
right? People will say, oh, they're less harmful than smoking cigarettes. You don't know
You
that.
don't know yet.
You don't
Yeah.
know that because they haven't been on the market long enough. But I'll tell you one thing, I guarantee you they're not, because the only thing that we're meant to inhale is oxygen.
Yeah.
So if you inhale something that some foreign substance, you're going to damage some parts of your body, right? In the long term. We
We
just
haven't
haven't
seen it
seen the
yet.
long-term effects. I'd be more afraid of vaping. Well, that's not true. I'd be afraid of all of it, to be
Yeah.
honest. But I find it particularly terrifying because we actually don't know the long-term effects. We do have some data about short-term effects. One of
Okay.
my friends study, she did, I'll just tell you real quick. She did a study of college students who hadn't vaped at all, who were naive to using any tobacco products. And she was
Uh-huh.
looking at their cardiovascular disease. And she had really fit young people who were like athletes. And you should have seen the cardiovascular activity once they went in to try the products. It was insane. And I was just like, this is going to devastate our communities, not just because of respiratory disease, but
Mhm.
cardiovascular disease, because nicotine affects cardiovascular
Right.
disease,
Right.
your cardiovascular systems, your
Yeah.
heart, right? So it's it's tough. It's really tough. And it breaks my heart every single day that we missed
Yeah.
the
Yeah.
mark. Now we've got to figure out how to clean it up and get it out of our neighborhoods.
Right. Thank you for that. Got about 8 minutes left. Um, I want to ask, what advice would you give Black individuals who are currently struggling to quit smoking or vaping?
Ooh. First of all, give yourself grace,
Yeah.
right? Understand that you're using a product that is intended that is designed uh, for you to not be successful, right?
Mhm.
Because they're highly addictive, right? So you have to understand the situation that you're dealing with,
Okay.
right? Um, give yourself space to try different avenues that you feel that will work best for you, and give yourself grace if it doesn't,
Okay.
right? Because not things are not one size fits all,
Yeah.
right? Um, and seek support from those that you can, those people that your social networks that will support you. And quite honestly, I would try to like just back up
Yeah.
for those folks that aren't interested in the same thing that you are in at this point in
Okay.
time, trying to quit, because sometimes it makes it more difficult,
Yeah.
right? Um, but and find a program or a um, support system or a network, or try the Become an X program, whatever it is. Find what works for you. But the biggest thing that I have to say is just know it's really
Yeah.
hard,
Yeah.
and it's okay for it to be hard for you, right? And just know that we stand on the shoulders of like
Mhm.
superheroes, so we can get there.
Yeah.
It's just like everything else, and for us, it just takes a little while, and sometimes it might be a little bit harder, but we'll get there.
Yeah.
That's
Thank
what I
you.
think.
And one more question. What future research, or excuse me, what future research or initiatives do you believe are needed to further smoking, to support smoking and vaping cessation in Black community?
Mm. Mm. That's a big one for me. So my colleagues were working on an attempt to ban mentholated combustible cigarettes in this country, and got this close.
Mm.
Um, and unfortunately, the federal government has rolled it back, and
Mm.
we don't know if it's going to happen or not. And these are the same
Okay.
people. These are people that I very much admire. These are folks that were
Okay.
able to ban menthol or
Okay.
flavored tobacco products in California and other states, right?
Okay.
So one of the things that I would think about is, how do we affect policy if we can,
Okay.
right? Some folks are in states that they have these things called preemption laws that make
Okay.
it difficult for a local. So if I'm in Virginia. Virginia
Okay.
has preemption laws, and so I can't try to advocate, or I can try, but it would be very
Mm.
difficult for me to initiate a ban of flavored
Okay.
products.
Okay.
Those are quite insidious because young people use them. So trying to do something locally is really hard for me because my state doesn't allow me to do that,
Gotcha.
right?
Okay.
But I think that focusing on policies that intersect with tobacco use in our communities, like if we could try to find, create smoke-free zones within our own
Yeah.
communities, things of that nature, which we don't, but we can,
Yeah.
right? We have community gardens to increase, access to fruits and vegetables. Can we create smoke-free zones in those
Yeah.
spaces as well? So policy is one thing, but advocating for greater resources to be invested in cessation is an important thing. And if you know what, if they don't do it, build it yourself, right?
Yeah.
So if you can't rely on someone else, if the state and the federal government and local government is not investing the way that you want to, build it yourself. You can create communities. You can find access to online resources and create those groups within your own
Yeah.
communities
I agree with
yourself,
that. I agree with
right? So we can try to use all the levers within government,
Right.
but if it doesn't work, I mean, historically we know this, right? When government hasn't worked for us, we created it ourselves.
Yeah.
And so we can do the same thing with cessation programs in our own communities. And you can also access free programs that are available to us. So we have to try
Yeah.
and
Well,
be
this was,
creative.
yeah, I think we do. We have to, like you said, you kind of stated perfectly, and I'll say this real quick when you said, we always say Black Lives Matter, but we have to matter to ourselves. We really have to figure out how do we get involved in our community, and whether it's the schools, whether it's just like a community center or whatever, and really talk about the harmful effects of smoking. And for parents, smoking in the house with young kids is like, it's such a domino effect. And so like that, making sure we're out there giving that information to our communities so we can understand, the effects of it. Because, oftentimes we see it, we see our parents do it, and like, we just don't know. And I mean, and I don't think it's crazy to even say folks don't even really know. We know that smoking can cause cancer,
Cancer.
you know,
But we don't talk about
we
cardiovascular
don't
disease.
know
We don't talk about
exactly.
respiratory disease. We don't talk
Right.
about diabetes. We don't talk about cigarette smoking affects
Everything.
everything, right? And so, or excuse me, tobacco
Yeah.
use. And again, with the whole vape thing, we just don't know yet.
Right.
That's what really makes me afraid, because it's
Yeah.
like this black box. But it affects all of these systems within our bodies. But that has a domino effect on what happens with our communities, right?
Yes.
Because when we're not well, we can't rise,
Right.
right? And
Yeah.
so it has, and people always think it's just a small minor thing. No, it's interconnected with so many different
Mm.
elements of our communities, and we have to disentangle them. It's not cool to go to hookah lounges for brunch anymore. I don't care how good the music is.
Yeah.
We don't want to do that
Yeah,
drugs. We have to
exactly.
love ourselves, as you said, right?
Yeah.
And menthol cigarettes, it's not a black thing. No, it's something that they put in our communities, and then we can't get it out, right? And so we have to understand who we are and love ourselves. And then we have to help each other. That's what we need to do, is work together and help each other to rid our communities of these issues.
Well, thank you for such a wonderful, wonderful conversation. This has been just an eye opener for me. And what can I do for my community? Trust and believe you have put me on a mission. I
That's
am.
right, girl. Love
I
yourself and love your people.
yeah.
'Cause
So
I do.
thank you.
I do. Thank
Thank
you
you
so
so
much.
much. Thank you so much.
Fantastic. Thank you
Yeah.
so much for having me. And thank
Thank
you
you.
for spending this time with me.
Yeah. Thank you. Well, have a great day. And I mean, you may see an email from me or something. What can I do? Just because my,
Good.
so yeah,
Let's do it together, because let's
definitely.
fight together, right?
Yes.
And
Yes.
anybody else out there, you can email me. Let's figure it out. Let's fight together, because we can overcome this one. This is
Yes.
something we can overcome.
We could definitely do. Well, thank you so much.
Thank you for having me. Take care.
Bye.